Hello, my name is Jocelyn McGuire. I'm a nurse practitioner at Norton Neuroscience Institute's Hussing Family Multiple Sclerosis Center. Thank you for joining me for this discussion of how and when to talk to your MS provider about relapses. Whether you're newly diagnosed with MS or have been living with it for years, I hope you'll find this presentation informative and helpful in managing relapses. A relapse is also known as an exacerbation, attack, or flare-up. It is a new or worsening symptom that lasts more than 24 hours and is separated by at least 30 days from the previous relapse. Other causes for the worsening symptoms, such as infections, must be ruled out. A relapse is caused by inflammation in the central nervous system. The inflammation damages myelin, which is the protective covering around nerve fibers. When the myelin is damaged, the nerve cannot effectively send signals. You should call your MS provider if you are noticing a new symptom or worsening symptom that lasts more than 24 hours. Some examples include worsening balance or more falls, weakness in your right leg when you previously only had it in your left leg, double vision or eye pain. Again, these are just a few examples and not the only symptoms you should call about. Once you call, your doctor, nurse practitioner, or the nurse navigator will review the symptoms you're having and determine if you need to come in for an appointment. When you come in for a visit to discuss a possible relapse, be prepared to answer a lot of questions. Some of the questions we'll ask are, is this a new symptom? Is this a symptom you've had before but is worse or different in some way? When did this start? Have you been out in the heat a lot recently or in a hot tub? Is there anything going on in your life causing you a lot of stress? Have you been getting your normal amount of sleep? Have you had a fever or any recent infections? What we're trying to find out with these questions is if the symptoms you're experiencing are an actual relapse or a pseudo relapse. A pseudo relapse doesn't mean your symptoms aren't real. It means they're caused by something other than a new lesion on your brain or spinal cord. Things that can cause a pseudo relapse include exposure to heat, stress, fatigue, or infections. We may check some labs and obtain a urine analysis to make sure there's no sign of infection. At your visit, we'll also compare your physical exam to the previous exam to see if there are any differences. This is helpful in determining if there might be any new lesions. The next step may be to obtain new MRIs to evaluate for a new or enhancing lesion. An enhancing lesion means that it is a brand new lesion and looks bright white on the MRI imaging after contrast dye is given through an IV. For more severe relapse symptoms, we may prescribe high-dose steroids. Steroids can cut down on inflammation and shorten the amount of time the symptom persists, but does not reverse the damage caused by the relapse. Steroids are typically given through an IV over 1 hour for 3 to 5 days. There have been studies that have shown that an equivalent oral dose of steroids are also effective in treating relapse symptoms. An important note that while steroids can help improve the symptoms, they do not necessarily work immediately. It may take weeks or months for the symptom to improve. In some cases, the symptoms may not go away completely, and the individual does not return to where he or she was before the relapse. Acthar Gel is an alternative to steroids. It helps your body to secrete naturally occurring glucocorticoid, similar to steroids, which helps cut down on inflammation. It is used for individuals who are not able to take steroids. Individuals with milder relapse symptoms may not need treatment with steroids or Acthar Gel. We may recommend using rehabilitation therapies or other medications that help manage symptoms. Physical and occupational therapy can help with improving mobility, balance, and activities of daily living, such as feeding and dressing. Speech therapy can help with speech, swallowing, or memory and other cognitive difficulties. A note to remember is the importance of sharing with your provider what your symptoms are and how they've changed. If we know what you're experiencing, we can work together to find the most appropriate treatment or therapies to help improve your relapse symptoms. Thank you for joining us. If you have questions or would like to learn more, please contact the Norton Neuroscience Institute Resource Center.